Menstruation is a natural biological process in the bodies of girls and women, which is an essential part of the reproductive system. This process indicates that the body has reached puberty and is ready for possible conception. Menstruation, also known as a period, is the periodic discharge of blood and mucus from the uterus through the vagina, which occurs due to hormonal changes in the female body. First and foremost, it is important to understand that menstruation is not a disease or something unclean or shameful. It is a natural physiological process, without which the continuation of the human race would be impossible. The menstrual cycle is a monthly set of changes in a woman's body aimed at preparing for possible pregnancy. On average, it lasts from 21 to 35 days, and menstruation itself lasts from 3 to 7 days. The beginning of menstruation is called menarche. Menarche usually occurs between the ages of 9 and 16, most often between 11 and 13. The age at which it begins depends on many factors: genetics, nutrition, lifestyle, level of physical activity, health status, environment, etc. For example, girls who are very physically active or have low body weight may start menstruating later. On the other hand, girls with early physical development may experience menarche as early as 9 to 10 years old. Before the first period begins, a girl may notice certain signs: breast development, the appearance of hair in the armpits and pubic area, mood changes, and vaginal discharge, all of which indicate the start of hormonal changes. The arrival of menstruation means that the ovaries have begun functioning, an egg cell matures each month, and the uterus is preparing for potential fertilization. During menstruation, blood is released from the vagina, consisting not only of blood itself but also of mucus, endometrial cells, the inner lining of the uterus, and the unfertilized egg. The color of the discharge may vary from bright red to dark brown. This is completely normal. The amount of blood lost during menstruation is individual but usually averages around 50 to 80 milliliters over the entire period. Menstruation is a sign that the body is working correctly. At the same time, the cycle may be irregular during the first few years. This means that periods may start earlier or later than expected, may be delayed, or come more frequently. Such irregularities are normal for the first 1 to 2 years after menarche. Over time, the cycle stabilizes, but it is important to observe one's body, record the dates and duration of periods, pay attention to overall well-being, pain, or unusual symptoms. Some girls experience pain in the lower abdomen, lower back, or breasts during their period. This is caused by uterine contractions trying to expel the old endometrial lining. Such pain is usually not dangerous and can be relieved by light physical activity, warmth, or painkillers as recommended by a doctor. The onset of menstruation is a significant stage in a girl's life. Menstruation is not just a monthly cleansing of the body. It is a complex biological mechanism that plays a crucial role in the female reproductive system. Its main function is to prepare the body for a possible pregnancy. Every month, a woman's body goes through a cycle of hormonal changes that regulate the maturation of an egg, the preparation of the uterus for implantation of a fertilized egg, and, if fertilization does not occur, the shedding of the endometrial lining. The menstrual cycle begins on the first day of menstruation and lasts an average of 28 days, although the normal range is 21 to 35 days. In the middle of the cycle, around day 14, ovulation occurs, the release of a mature egg from the ovary. If the egg does not meet a sperm cell, it dies, and about 14 days later, menstruation begins. Thus, menstruation is the result of the body preparing for a pregnancy that did not happen. Each month, the female body invests a lot of energy in creating the conditions for a possible pregnancy. The hormones estrogen and progesterone stimulate the growth of the endometrium, the uterine lining that provides a nurturing environment for an embryo. If fertilization does not occur, hormone levels drop sharply, the endometrium detaches, and is expelled from the body as menstrual blood. This process clears the way for a new cycle to begin. This cycle is essential not only for reproduction but also for maintaining overall hormonal balance. The menstrual cycle affects skin condition, mood, energy levels, appetite, sleep, and concentration. Many women notice changes throughout the cycle. On some days they feel energetic, while on others they may feel emotionally sensitive or tired. This is normal. Menstruation is not the enemy but rather a health indicator. If the menstrual cycle is regular, without excessive pain, long delays, or heavy bleeding, this is a sign that the body is functioning properly. Conversely, cycle irregularities may signal problems such as hormonal imbalances, stress, chronic fatigue, infections, or gynecological conditions. That's why menstruation is also a health indicator, and any changes should not be ignored. Many women find that once their periods become regular, they become more in tune with their bodies. They learn to interpret the signals their bodies send, like breast tenderness, mood shifts, or increased sensitivity, all of which may signal that their period is approaching. Knowing your cycle allows you to plan physical activity, work, rest, diet, and more. Practically speaking, menstruation also plays a role in resetting the reproductive system. The absence of periods for an extended time in women of reproductive age, excluding pregnancy or breastfeeding, is a serious signal to consult a doctor. Regular menstruation means the body is maintaining a proper hormonal rhythm, which supports not only fertility but also general well-being. Menstruation also helps women make informed decisions about their reproductive. Every woman eventually reaches a stage when menstruation stops. This phenomenon is called menopause. It is the natural end of the reproductive phase of life and signals that the body is no longer capable of natural conception. Menopause is not a disease or a problem, it is a natural biological process, much like the beginning of menstruation, brought on by hormonal changes. Menopause typically occurs between the ages of 45 and 55, with the average age being around 51. However, in some women, it may start earlier, premature menopause, or later. Factors that influence this include genetics, overall health, lifestyle, stress levels, physical activity, nutrition, and certain medical conditions or treatments, e.g., ovarian surgery or chemotherapy. Menopause is not a single event but a gradual process that lasts several years. It is usually divided into 3 stages. Perimenopause, the period when the menstrual cycle becomes irregular, and the duration and nature of periods change. This phase may last for several years. Menopause, the last menstrual period in a woman's life. It is diagnosed retrospectively after 12 months with no further bleeding. Postmenopause, the period after the final menstruation, during which the ovaries no longer produce significant amounts of hormones. During this time, women may experience certain physiological changes, hot flashes, night sweats, sleep disturbances, mood swings, decreased libido, vaginal dryness, reduced skin elasticity, weight changes, and increased risk of osteoporosis and cardiovascular disease. These symptoms result from decreased levels of estrogen, the main female sex hormone. Despite this, many women go through menopause actively and without significant discomfort. Proper nutrition, physical activity, healthy sleep, avoiding smoking and alcohol all help reduce the symptoms of menopause. If needed, a doctor may recommend hormone replacement therapy, HRT, which can improve quality of life during this period, though the decision should be made individually. It is important for women in the menopausal period to continue regular checkups with a gynecologist. Although reproductive function has ended, female health remains important. The risk of cancers, cardiovascular issues, and osteoporosis increases during this time, so prevention and early diagnosis become especially important. The psychological side of menopause also deserves attention. Society often perpetuates the stereotype that menopause is the end of a woman's full life. In reality, this is not true. This period can be a new chapter, a time for personal growth, professional development, and self-discovery. With age comes maturity, confidence, wisdom, and inner balance. It's important to remember that menopause is not a sudden loss of all feminine qualities, but a transformation. Many women note that after menopause, they feel freer. No longer concerned with menstruation, contraception, or PMS. This allows them to focus on them's